Hey everybody, it's Miss Sullivan, and today we are talking about performing autopsies. So, this unit comes right after we have learned about the changes that occur after death and how to calculate time of death. And the big part of this unit is that we are going to be doing an autopsy on a pig. So that is our first learning target, planning and carrying out the investigation of the pig's death. But also, from that autopsy, we are going to work again on constructing an explanation, this time of what the possible manner, cause, and mechanism of death are for the victim, based on the evidence that we collect during the autopsy. So to get started, we're going to do our know and need to know table. So I want you to fill this out, and you're going to submit it as the next part of your assignment today. So in the know column, I want you to write down, what do you know about autopsies, either from TV, previous science classes, common knowledge. What do you know about autopsies, but also, what do you know about the human body? You can add things from the changes that occur after death, or calculating time of death that you've learned, but also think about um, what body systems would be affected by different injuries, what would we be looking for, what are possible environmental factors. And then in your need to know column, I want you to write down, what do you think you still need to learn in order to perform an autopsy on a pig? Um, and especially, what do you need to know in order to write an autopsy report? How would you take the evidence that you find during the autopsy and turn that into conclusions that an investigator could use to solve a crime? So go ahead and pause this video and write down what you know and need to know, and press play when you are ready to move on. Okay, so the first thing, what is an autopsy? An autopsy is a post-mortem exam. So post-mortem meaning after death. Um, and it includes the dissection to determine the cause of death. So the entire body is going to be investigated, not just, for example, a bullet wound. Like, you're not going to just stop there. You're going to take in all considerations in an autopsy. Now, not every person who dies has an autopsy performed. So what requires, or what warrants an autopsy, is if there is a questionable cause of death as determined by the coroner. So if there's some sort of concern that the coroner has, or reason to be suspicious, that it might not be what it seems. All homicides are going to require an autopsy. Drownings are also going to require an autopsy. And that's really because someone could die before going into the water, or have a health condition that occurred that caused them to drown. Like if you were in the water and had a heart attack and then drowned. Auto accidents also can warrant an autopsy, and then the death of a child. So because it's unnatural for children to die, they will do an autopsy to determine the cause of death, but also it does help the medical field understand why that happened, if it was some sort of illness. But any death of a child would be considered warranted for an autopsy. Okay, so this is a quick reminder of what are our manners of death. So we learned this 2 units ago. Natural deaths, accidental, suicide, homicide, and undetermined are going to be our 5 manners. Natural, as it should be, is the most common, and it's from age, illness, or disease. Accident is something unintentional, like falling off a ladder and breaking your neck. Car accidents, unintentional. It could still be accidental deaths could still be from acts of nature. So like if you drowned in in a hurricane flood or if you were struck by lightning, those are still considered accidents. So suicide being self-inflicted, homicides are intentional through neglect or a reckless act. So it is up to the court to determine whether it's a murder. So in some circumstances, according to the law, a person is justified in killing someone in self-defense. Now, I told you before, undetermined is one of those things that we don't want to ever come to that conclusion. So if you're not able to determine the manner of death, even after doing the internal and external exams and all the toxicological tests, then you would put undetermined. But this is not something that families or investigators want to see on a death certificate. Okay, so a death investigation. First, you're going to begin your investigation at the scene. So the preliminary investigation starts when you arrive at the scene. Then the body is going to be sent to the morgue. The medical examiner is going to be the one who examines the body and performs the autopsy. So in Kentucky, we have, for a few years, they consolidated all autopsies to Frankfurt, and they had the state pathologist overseeing all of that. We used to have regional facilities where they would do autopsies, and I think they're looking at getting back to that, but I need to ask the people that I know in the field if they have opened up the regional autopsies again, or if every body is literally sent to Frankfurt. So the medical examiner is going to be the one who orders the lab tests on the biological evidence to look for different drugs, poisons, or any other tests that might need to be run on samples taken from the body. Okay, so when you are at the death scene, so we're calling it a death scene instead of a crime scene because perhaps it's not a crime at this point. They would draw sketches of how the body was found, but also, most importantly, is taking photographs of the scene, the victim's face, and the underside of the body. The underside of the body is important because of that livor mortis that we learned about. So the pooling of the blood on the lowest points of the body. After 2 hours, it begins to show that purpley bruising. And after 8 hours, it's permanent. And so the underside of the body can tell us if that is the position that the body has been in since death and how long they've been there. So you would make sure to document any signs of trauma. You would estimate time of death using the evidence that you have available to you. So they'd take the temperature of the liver or rectally, depending on the condition of the body, to estimate time of death, as well as looking at the rigor mortis, livor mortis, and possibly the insect evidence. And that is going to indicate to us what that post-mortem interval is, or the range of time after death. So the medical exam, we have to treat the body as part of the chain of custody. So everyone who handles the body has to be documented. They would handle when the body arrives, who was in transport, and who received it. The point of the medical exam is to determine that manner, cause, and mechanism of death, but they might not know these things until after the autopsy is completely finished. The first step of the autopsy is going to be an external exam. So we're going to investigate the clothing and the body and order x-rays. X-rays can help give us an overview of what is going on inside the body before you begin the dissection, because you can look for bullets, different injuries to the bones, maybe some medical procedures that have like a plate in their leg that you could use to find a serial number. Biological evidence from the outside would be taken, and also non-biological evidence. So this is where they would look under fingernails and look for any evidence that was left on the body. Sometimes they can even get fingerprints off of a body given different conditions. But this is the important gathering of evidence before you proceed. All right, so again, I said before that they're going to help determine the time of death at the scene. One of those things that they're going to rely on is algor mortis. So we have been working on the cooling of the body. calculations, that is something that they would be considering in their investigation. Okay, so I'm going to show you some of the tools that they would use. So they would collect samples from the body and package them to be sent off to the lab. There are different tubes for each of the different samples that they are collecting. Everything needs to be tagged. So you're going to have your biohazard tags because it's biological material. If it's contaminated with anything radioactive, they would have to label that as well. This is a heart needle, so to take specimens from the heart. So the benefit of the autopsy is it helps determine the cause of death, and it is very important for our criminal cases. So in order to proceed, we need to have definitive evidence that it was a type of death that is related to the crime. It does give the family peace of mind to have that closure about what happened to their loved one, especially with death of children and unexpected deaths. Understanding genetic diseases or deformities that could have caused that is very important. It's also necessary for many insurance claims that we have the autopsy to back up the cause of death. So insurance usually will cover natural deaths, but some plans do not cover suicides. And so having the clear, this is what caused the death report is going to make sure that the insurance pays the claim and does so quickly. So autopsies can also be used for medical advancement. Um, Autopsies were first performed publicly as like a spectacle, like in the like Renaissance kind of time. I mean, they would just put a body out on the square and dissect it and show the parts to watching um, like citizens as entertainment. It was very gruesome. Sometimes they would use people who weren't dead for more of the spectacle of spraying blood and stuff. It was not a great time to be those people, but the experimentation that they were doing on the human body did lead to a lot of understanding about what people look like on the inside. And then now we can still learn more from these autopsies. So, like I said, we're going to start in the external exam. They would take x-rays. So this is a compound fracture. You could look for the medical history. So this person having the screws put in to stabilize a previous injury would be something that we could look up and compare to the victim's medical records and know that this is indeed that person. So we've got pins in a hip here. All right, so this is the autopsy room. So you would have the body on a table similar to this, where the body would be elevated and there would be a slope to this bottom that would allow it to drain. There's the sink at one end for the medical examiner to wash their hands, to wash off any specimens that they need to. And there's also the scale that's hanging. So we will take measurements of the different organs to compare them to normal standards. Like you could maybe see if somebody had an enlarged heart. So the external exam, collecting trace evidence, looking for those signs of injury or mistreatment, signs of illness, disease, or abnormalities. So here we're looking at, there are some abrasions on the skin. In this picture, we have a burn, probably like a cigarette burn on the bottom of a foot. These are things that would need to be documented in the external exam. This is a body block, so this would be used to support the neck of the body and to elevate it slightly. So once you've done the external exam, it is time to begin the internal exam. And so the trunk is going to be dissected using a Y-shaped incision. So starting at the shoulders, like collarbone area, and then coming to a point in between the chest, and then going down to the pelvic bone, straight down the body. It is a very deep incision. When you are doing this, you want to make sure that you're getting through all the layers of skin and fat, but especially on the abdomen, you don't want to puncture any of the organs. So there is a point where you feel the cut opening a little bit, and that's where you need to stop. So I will show you how to make the Y incision when we do our pig autopsy. So opening the chest, you're going to pull back the skin and muscle from the chest wall, and the chest plate is going to be extracted. So along the sides of the like trunk of the body, you would trim the ribs in order to take this chest plate directly off. And then the heart would be extracted and weighed and set aside for the moment. So in the dissection, you're going to remove one organ at a time. There is another method to take all the organs out at once, but that's not as common as far as I understand. As you remove each organ, they're weighed and measured, examined for any abnormalities or injuries, and then they're sliced in cross sections. So these cross sections give you an internal view of the organ to look for any internal abnormalities, but we also take samples from these cross sections to send off for microscopic analysis and chemical analysis. So checking it for any possible medications, toxins, drugs, and microscopy looking for any abnormalities in the cells, which might mean like cancer or some other type of tumor. So the sample jars would all be labeled from the body, and they would be sent off to be analyzed, and they would have to be labeled properly and use the chain of custody as well. So the body is going to have a lot of fluids. They would have some tubing to help remove the fluids from the body and get them out of the way. All right, so removing the brain, the scalp is going to be cut from ear to ear across the crown of the head. So that's like along this line here on the top to the back of the head area. The scalp is going to be pulled forward and back to expose the skull. And then there are a couple methods for cutting the skull cap. So removing the skull this way, so they would use kind of like a Dremel-ish tool, bone saw, to remove the skull here. When I do the pig dissection, I will not be using the Dremel tool type thing. We have a little bit different of a way of doing that for our pigs. Then the spinal cord is going to be cut, the soft brain is removed, and the brain is so soft that it's going to need to be preserved. So the pig's brain that we're going to work with is already preserved, and it is still incredibly soft and very difficult to remove. So it's important that you have a large enough opening in the skull to be able to gently lift it and then preserve it for about a week before you would be able to do the in-depth exam of measuring it and doing cross sections. Once the autopsy is complete, all the organs have been weighed and measured, everything has been documented, looking for all of the different abnormalities or injuries. Then the skull cap is going to be put back on, the skin will be pulled back in place. The body organs may or may not be replaced. If they are replaced, they're not like reattached or put exactly in the same spots, but they are returned to the body cavity. And then the incision is going to be sewn up with the use of a baseball stitch. So if you are familiar with what the stitching looks like on a baseball, that is the style of stitch that they would be doing. And it would look something like this. So you are going to submit your know and need to know, and you answered the questions as you move through this video. And that is all for today. Tomorrow we will be reviewing the human body systems and what they do in preparation for our pig autopsy scheduled pending any changes for Thursday. Have a great one.